again, everyone. I hope you had a good break. I want to talk a little bit about the tools and the support and the resources that Planet Youth does provide throughout this process. As kind of mentioned in my introduction, I used to implement Planet Youth in Vermont. So I was there from the very start. I went to the conference in Iceland with a few other folks from Vermont, and we decided we really wanted to do this, and we developed that project, and I was with that project for a few years before joining the Planet Youth team. So one of the first things that happened, though, is you go to the conference, you get those articles, those great articles about how to do this and resources, and then you sit down in your community and you're like, okay, now what? What do I do? Because it's a lot of information and you have to figure out a lot of big logistics. So I want to talk about the supports we offer while you're figuring this out and while you're going through the 10-step process. I just want to mention a few things we really do value are reliability, transparency, learning, and growth. So we always aim to be reliable. We want to be there for you while you're working through these steps. You're never too far away from us, whether you're on the coalition, in the community, or you're the coordinating level. We're very transparent about what we can and cannot offer. But the great thing is this process is so adaptable in communities, and while you're learning and growing with us, we're learning and growing with you. So this isn't going to look the same in every community. We're really open if you want to adjust and need different supports than our other communities are receiving. Some examples of our role, we have a lot of different roles and we have a lot of different supports. So one thing that will happen is when you sign on, you get assigned a project manager, and that person's with you every step of the way. Every 2 weeks usually they're meeting with you. Sometimes communities choose to do every month, but that's really up to you. You have someone that's always going to be your go-to person that you can always reach out to, and then they connect you to the rest of the team if you need more specialty support. We offer tons of trainings, and I'll go a little further into them in another slide. We offer pre-survey trainings so you understand about the survey and how we collect data and our reporting. We talk about coalition building, dissemination planning, action planning, all that good stuff. We also do specialty trainings if a site decides they need something specific that we don't currently offer. Another great thing is data analysis and reporting. So something to mention is this survey is so great because you get the data back in 6 weeks. You know what's happening with your young people right now. And I know that's not typical of a lot of surveys and a lot of data. It was so useful for us in Vermont when our survey was done in September, and then before the end of the year, we had that data back and we could go into the communities and talk about it and create goals and strategies. We also have advisors. I'm an advisor at Planet Youth. We have Inga Eva, who's an advisor at Planet Youth, and we really go into communities. If you ever are having a lot of trouble and challenges, we help you troubleshoot. We help you figure out how to get back on track. So a lot of different supports. I'm going to go into some of these tools a little further. Of course, there's far more than I can talk about today, but I just want to give you a quick overview of some of those bigger tools and supports we offer. This is something I'm super proud of because I was one of the leads on this project, this community implementation guide. We realized communities really need this easy to understand step-by-step guide. It's 92 pages and all our partners get it when they sign on. You don't have to read it all at once. I recommend you stay in the step you're in so it doesn't get too overwhelming, but it really breaks down each of the 10 steps. It provides guidance on what you might want to do. Whether it's coalition building, data dissemination, it gives examples of what other communities have done, resources, external links to other places that have more advice on each of these topics as well. As mentioned, we have a training series, and again, if you need a training that's beyond this training series, we offer that as well. We have an intro to Planet Youth, coalition building, preparation for data collection, your results review. We always make sure you have a really good understanding of your results and how to talk about it in your community. We never want you to feel alone with that. We know that disseminating data in communities can be complicated, so we really make sure you have a lot of support. We talk about a dissemination plan and how you're going to disseminate this and how to create goals and strategies, and then moving forward, how to implement in the communities. We also make sure our partners can connect with each other and share with each other. That's really, really important, especially as we've grown and expand all around the world. We have a Facebook group for our partners where they're often asking for advice or sharing some exciting things they're doing. It's a really fun group to be a part of. We also have cohort calls, so you'll be interested to know we have a North America cohort call, and that happens quarterly. This is done without Planet Youth, so you can talk freely about what's going on without us being there. But they really support each other. It's all the groups from the United States and Canada, and they just share what they're doing and what support they may need from each other moving forward. And finally, you're not alone in the process. So something that I work a lot with is this process follow-up tool. It's a survey that our community coordinators often fill out every 6 months. It goes through the 10 steps and what you've been doing. And based on that, I usually check in with the communities as the advisor, and we talk about what troubles you may be experiencing, how we can help support you move forward. It allows you to readjust your action plans before you get too far ahead. So if something's happening that's not working well or is working well, you can really take note of that and move forward. So I'm going to move on to the partner experience. We have been talking a lot about our experiences as Planet Youth employees, but I want you to hear from our partners how they've experienced Planet Youth and how they've set up Planet Youth. The first video is from Melanie in New Brunswick, and I actually think this site is probably very similar to this area. We have a Department of Health staff that have been really arranging it and setting it up, and then they talk about their community coalitions and their pilot sites. So I'm going to let you watch each of these videos, and then if you have any questions, you can let us know.
Hi, my name is Melanie Cormier. I'm a Senior Program Advisor with Public Health New Brunswick and the Project Lead for Planet Youth. I'm happy to have the opportunity to give you an overview of our project here in New Brunswick, as well as share our experience with Planet Youth so far. For us, it all started in 2019 when our Chief Medical Officer of Health, along with others from the Department of Health, had the opportunity to attend the annual Planet Youth Conference. Following this, Planet Youth was identified as one of the 12 key priority initiatives in the Interdepartmental Addictions and Mental Health Action Plan back in 2021, and as a key priority under the Addictions and Mental Health pillar of our 5-year health plan, released in 2022. This enabled us to sign a service agreement with Planet Youth to pilot the Planet Youth Guidance Program in 4 pilot sites over the next 5 years. 4 pilot sites were chosen to determine under what condition the model would be best adapted to the New Brunswick context. Selection was made based on various factors that included ensuring a balance of representation of rural and urban areas, of Anglophone and Francophone communities, and the ability to invite First Nation communities to participate, as well as a geographic distribution across the province. We also looked at communities who had common priorities and strengths, and at networks who had demonstrated a strong capacity to work across community boundaries. While the work is funded and monitored by the Government of New Brunswick, it's important that the approach be community-led. Each of the 4 regions have a local action team or coalition comprised of 2 co-leads and members ranging from subject matter experts to health promotion and community stakeholders and volunteers they work closely with the schools in the region. These local teams are supported by a provincial support team to help them shift barriers and leverage enablers that have been identified as challenges or as being out of scope at the local level, as well as identify opportunities for creating policy windows based on the work identified or advanced at a local team level, such as developments that would benefit beyond a singular action team. We also have a provincial coordinator fully dedicated to the implementation of Planet Youth here in New Brunswick. We have had the support of the Planet Youth team since the beginning of planning. The project coordinator and myself have monthly project management meeting with the Planet Youth team, which has been an incredible value in guiding us through the planning phase, trainings, and all the way to now. While we were supposed to start implementation in the fall of 2021, This was delayed a year due to the impacts of COVID-19 in our communities and schools. This past October, a few members of the Planet Youth team joined us here in New Brunswick for an official launch and to announce the 4 pilot sites. Following this, we identified co-leads in each of the 4 regions and started building the local teams. Robin has supported us through this step and has also offered a coalition building training to our 4 teams this past January. This training was very well received and enabled us to engage even more people locally. While these teams are developing, we started planning for data collection. Last week, we invited all of the schools administrating the surveys to attend a pre-data collection training, which was hosted by Planet Youth, and was very informative and prepared the school for the next step, which will be administrating the survey. This will be happening between February 13th and 24th here in New Brunswick. We're very excited to receive the findings early this spring and to start the dissemination and the action planning phases. We have already started planning with the Planet Youth team and have no doubt that they will continue to support us through these important steps. When I first took on the provincial lead role on this project, I was feeling quite overwhelmed and a bit out of place, as most of my career really has been focused on child and youth nutrition and health promotion. This was quickly changed, however, when I started working with Robin and the Planet Youth team. Whether I needed reassurance or advising and sharing ideas from other regions to some more unique needs, such as the need for all of our resources and training and logos to be both in English and French due to being a bilingual province, they've really been there to support. I'm also very grateful for the connection they've enabled us to make with some of the other regions implementing Planet Youth across Canada and around the world, as well as researchers and national organizations that are interested in this work. Thank you.
So our next video is from Frankfort, Kentucky. This is a site in the United States. So it's pretty far along. They're in their second or third year now. We wanted to include this video because it shows a good example of goals and strategies that can be created based around the data. It talks a little bit about the leisure card and also the parent cafes.
Hello, my name is Amelia Berry. I am the project director of the Just Say Yes Coalition based at the Franklin County Health Department in Frankfort, Kentucky in the United States. And our colleagues at Planet Youth asked that I share a little bit with you about our experience implementing the Icelandic prevention model here in Kentucky, as well as our experience working with Planet Youth through their guidance program. So I'm delighted to have the opportunity to do that. Our history with this model really was born out of desperation. We are in the heart of the area of the United States that has been hit hardest by the opioid epidemic, and really came upon this primary prevention model at a time when more and more of our young people were losing their lives as a result of overdose. And of course, we know that's just the tip of the iceberg, but that was a very painful and plenty motivation for us to start asking ourselves how we can get ahead of this problem and prevent our young people from going down this path. So really the idea of prioritizing prevention and then looking for effective models for doing that. Of course, many of us, like you there, I would imagine, grew up with the just say no mindset. It's what we think of when we think of youth substance use prevention, focused on individual choices, decision making, and of course we know that that is not effective at the population level. And so we were very drawn to Planet Youth, of course, first of all, because of Iceland's remarkable success, which was hitting the American media around 2017, which was about the same time that our community was truly had reached a breaking point in terms of alarm at the damage that the opioid epidemic was causing. But also this prevention model also exemplifies what the prevention field across the field kind of recognizes as best practices and effective practices, in that it's ecologically focused, so works on shifting the environments, that it's data driven, and also radically collaborative. So I'm going to talk a little bit about each of those things and kind of how Planet Youth has supported us. So we are, of course, a coalition, all of the usual suspects. I would imagine you there, like here, a coalition in and of itself is not such a radical thing. But what we've heard from our partners over and over again is that this coalition is different. And the main way that it is different has to do with data. And that is the piece where the Planet Youth Guidance Program is absolutely critical. Every aspect of this program revolves around fresh local data. So, for us, we use a version of Planet Youth Survey. We call it the Franklin County Youth Survey. We're actually right now in the middle of our third time administering this. You can see here, last year we had a 74% response rate. It was a little lower the year before. This is the first year that our schools are administering this, not in the middle of a major COVID crisis. And we've actually exceeded the 80% minimum that Planet Youth recommends at almost every school, and I believe we will get there at all of our schools. But essentially, this allows us to get really detailed, actionable information down to the school level about what's happening in the lives of kids, both in terms of substance use as well as the risk and protective factors in their lives, and sort of how those correlate to substance use, and lets us know where we need to focus our energies locally for prevention. So this is an example from our first year of data collection about out of school time activity participation, and showing a pretty clear correlation between high once a week or more participation and lower rates of substance use in terms of vaping, drinking, as well as cannabis use. And so this is something that we shared widely. That's a really important part of this model, and also one of the very valuable aspects of the guidance program service, because it's one thing to read in an article that the practice is to disseminate the data, but each year we have a workshop hosted by and led by the Planet Youth team that really walks us through the elements and characteristics of an effective data dissemination plan, and then we're tasked with creating a plan, which we then come back and present to the team and get their feedback based on their experience doing this all over the world. So it really has been tremendously helpful. And we have, through this process of having a very solid data collection process, the analysis, Planet Youth provides us with detailed reports as well as the raw data. So we actually can also do additional analysis, and it's very, very, very rich data, but formatted in a way that anyone in our community can understand, and then to have that direct, concrete assistance in planning out that process of sharing the data, and of talking with communities about, okay, how are we going to translate this into an action plan? How are we going to align our policies and procedures and practices to meet the needs or targets that are identified here as a priority for our community, has been so valuable. And again, is one of those things that I think is easy to say, in practice or sounds great and like the ideal that we're probably always striving for. But as one of our steering committee members said, this was a fellow who was a school teacher for 3 decades, and he said, we wrote all kinds of plans, we did all kinds of surveys and reports. They all sat on a shelf somewhere. This is not the case with this project, and that's really what is so different about this and is so exciting to our partners and our community and to me. The point here, of course, is to change these environments, the ecology of kids in these different areas or domains. We do have a program here called the Yes Card. It is modeled after the Leisure Card in Iceland. It's a small pilot currently. We've got about 500 students who receive a $400 electronic debit card each year that they use to pay for activities from a list of providers that contract with the health department. And so it really works just like a voucher, allowing more students to access activities that they may otherwise not be able to. And, this was exciting enough to have this program, but again, what has been so remarkable is to be able to measure it with very high confidence through high quality data, what impact that is having in the lives of youth. So we had one, the pilot for this project is at one of our 3 local middle schools. And so we were able to compare the change in participation in out of school time activities from the first survey to the second, and the launch of the Yes Card was started around the time of the first survey, and so it provided a nice baseline, and you can see here increases in music, art, drama, and dance, some increases in volunteer and other after-school activities. Sports aren't on here, but those increased significantly as well. And basically, some of my graphics aren't showing up here, but you've got the numbers here at the bottom. We were able to see that that regular arts participation went up 80% at the school that had the Yes Card. Sports participation went up 39%. There were increases at the other middle schools as well, but they were 3 times smaller. So this was very certainly very affirming and actionable, because it told us that this intervention was working. We knew that it had worked very well in Iceland, but that did not guarantee that it would work well for us here. So again, the data as a guide for our next steps. We've also used the data to inform how we work with parents and families. These are some photos from our parent cafes, which we selected among a variety of interventions we could have chosen, but our data really showed that there was a need for stronger connections between parents, and then that's something, as we went out and disseminated the data in the community, we heard from parents directly as well that was something that was important to them. So parent cafes grew out of that. Just want to end with a couple of quotes from one of our steering committee members. We did a series of interviews with all of our steering committee members last year as part of a process evaluation, and we were looking at whether and how this model and working with Planet Youth had changed the way that we do prevention work here. And I'm including comments from Charlie Kendall, who's a coordinator of our local agency for substance abuse policy. But really, we heard these same points expressed over and over again by everyone on our steering committee. Impressed with the content and quality and passion of the trainings provided by Planet Youth. And because this was a collective experience with other steering committee members, the training reinforced the community. And then, this sense that there's usually a promise of fact-based decision-making and prevention, but this is real. Being able to not just get the data, but to then turn it around so quickly has been the key, and then to use it. It's a standard that will be hard for others to meet in terms of data-supported, evidence-based prevention. And we get contacted from people all over the world who want to know about what we're doing. There's a lot of excitement about the Yes Card in particular, and we actually recently started hosting monthly webinars. There's a sign-up link here. You're welcome to join us the first Friday of every month. But you know, I'm always asked in the Q&A what I would recommend for communities who want to get started with this model. And always the first thing I say is sign a contract with Planet Youth. There is just no way that we would have been able to accomplish what we've accomplished without them. Having, you know, with this model, it is a model, it is a process, it is a structure, but that entire process and structure is geared toward ensuring that the prevention work that you're doing is tailored to fit your community. That's why the local data is so very important, and Planet Youth have been just the most competent guides for us, and compassionate and patient guides and instructors and handholders. And I hear from our coalition members regularly that it gives them a lot of confidence knowing that we have researchers and practitioners who have done this all over the world, kind of advising us and there as resources whenever we need them in this process. So that's what I have to share. Here's some information about how you can contact me or learn more about our program. I did drop the webinar link for next month if you'd ever like to join us for that. And thank you for your time.
So we have another video from our partners in Calgary. This video, I want to just give a little context to. This site is doing really great work with, they're implementing Planet Youth in 4 pilot communities, and they're also doing an Indigenous parallel. In this video they sent in, this is of their youth well-being circles, where they brought together these young people to talk about what they want in the community, what they hope for the Planet Youth Project, and more. So I'm going to let the video speak for itself, but I just wanted to provide a little bit of context.
The thing that stood out for me in this program was the youth were given the opportunity to be a part of something where they were able to use their voice. And I know growing up in a city like Calgary, sometimes it's hard to speak up for yourself when things are kind of done for you in school systems or in like the system with child and family services.
To be honest, I was really surprised and puzzled when I was asked to be used as a youth elder for Planet Youth. After some time, I was able to reflect, and I realized it was an honor to be asked to be part of this. It felt incredible to know that I could be a positive role model for young people.
I really liked the bridging between Indigenous and Western perspectives because I haven't really seen that in many youth programs. It's usually more Indigenous or more Western. They've never been put together in one space.
We would begin each meeting by forming a circle and praying and smudging together, which was usually facilitated by an elder. Youth were able to speak up for themselves and share their truth during our discussions, which was the most rewarding part of the experience for me.
I appreciate, having the opportunity to gather with young people, small groups or large groups, for them to kind of really express themselves and tell us what we need to do. right? As adults, as agencies, as allies, as funders, as policymakers. And I've always felt that that kind of was kind of the way to go in relation to how do we change the environment versus how do we change the young person to fit into an environment.
I think the youth wellness circle could help break barriers of like intergenerational trauma, because we can work through the wellness of the youth and give them the guidance and resources that they need to work through whatever they're going through.
I'd like to see this initiative continue and our youth's confidence continue to grow. I'd like to see many relationships blossom as a result of our interactions. I'd like to see leaders emerge from the group. My hope is that the young people will be given the chance to serve as youth elders as well, and they will be provided with skill sets and knowledge in order to help the next generation.
I'm going to let Jan speak a little bit to just some of our partners that are working with Indigenous populations and really making that high priority in their projects.
Thank you, Robin. Just 2 or 3 minutes, because what we are seeing and hearing is there is more and more interest amongst different nations in finding out if Planet Youth can actually be used in order to strengthen and improve the environment of young people in the indigenous groups. We are already working in New Zealand, in Papakura with indigenous people, also in Australia, of course in Canada. Last year we got a visit from Washington State in the US, where the Lumi Nation came to us, sent 18 people, young people who are actually, they wanted to learn about Planet Youth because they are taking over the tribe as the next government, which was an honor for us. And now Washington State is again sending a group in the beginning of May, probably the governor also, and they want to try to see if they can make an example. They have 43 tribes in Washington State, and if they can make an example for other tribes in the US. So there is a lot of interest there. And finally, I would like to mention, I met with your Governor General last December, Mary May Simon, when she was visiting Iceland, and we met with our president. And I could also hear that she was really interested in our work, and we're truly gonna do what we can to adjust and adapt Planet Youth to improve the lives of the indigenous all over the world. So I just wanted to add that to the Calgary. So thank you.
So we just have one more partner video, and then I'll just talk briefly about who we are at the Planet Youth team, and then we'll open it up for questions. So please do ask any questions you may have after all of this presentation.
Good day from the Ottawa Valley. My name is David Sompe, and I'm the chair of Planet Youth Lanark County. I'm pleased to offer my congratulations and encouragement as you consider how upstream prevention can benefit your community. I personally started to learn about Iceland's success in preventing youth substance use at a community meeting in Lanark County in 2017. That meeting was focused on the opioid crisis. An informal group got together, and over the next year, we did some early work that we now realize is step one of the 10 core steps that you may learn about today. We officially formed our committee in June of 2018. As a community-based, volunteer-led initiative, we benefited greatly from mentoring, guidance, and encouragement from our local health unit. This was particularly important as we sought to engage with our local school boards. We also are blessed to have current and former school board employees as active members of our committee. Their guidance was important as we established a formal collaboration with the school boards. This allowed us in January of 2020, 18 months after we formed our committee, to announce that we were going to be conducting our first Planet Youth surveys in March of 2020. Little did we know that COVID-19 would shut the world down a few weeks before our planned surveys, and we would have a 2-year delay. So our reports, our surveys were done in 2022, and just about 8 weeks later, true to their word, the good folks at Planet Youth delivered community and school-specific reports back to us. That's one example of the great service that we've been receiving from them, and I'm sure you're going to agree with me after meeting the folks that you're meeting with today that the people who are working at Planet Youth are top-notch. Now, one question that I had, and perhaps you had, is how is this model going to work in a small community? Lanark County is 9 small municipalities. We don't necessarily have the resources that large urban communities have. I now understand, however, that small communities around the globe are embracing the Planet Youth model. I've had the opportunity to attend virtual meetings, webinars, conferences, and have one-on-one interactions to learn about what's going on in these small communities. And I can tell you that just like the folks who work directly at Planet Youth, the people who are leading this work around the world will, without reservation, answer your questions. These folks openly share their learnings and approaches. We have benefited greatly from this interaction, and I'm sure you will too. If you're interested in reviewing reports from the surveys from Lanark County, I invite you to do so by visiting planetyouthlanerk.ca. You can also visit websites that have been set up by other communities around the globe. I've found ones from the west of Ireland, from Franklin County in Kentucky, and from Blue Mountains in Australia to be particularly useful. Now, in an ideal world, I'd be able to tell you that we are well into step 7 of the 10 steps. That is community goal setting and developing organized responses to survey findings. But the pandemic imposed delay hurt us in at least 2 ways. One is we lost momentum in community engagement that we're rebuilding. Secondly, we lost momentum in fundraising that fundraising was targeted towards raising money so we could hire a project coordinator. Getting both of these going again was challenging in a year that had both a provincial and a municipal election. But we're getting back on track now. I do strongly recommend that you listen to the guidance from Planet Youth and that you have a paid person who has protected time to lead the work in your communities. It's very, very satisfying work, but it does take a lot of effort. I can tell you that from personal experience. I can also tell you that the survey reports are starting some very interesting conversations across Lanark County. One example I'd like to give you is related to sleep. We find in our data that 70% of our grade 10 students are sleeping less than 7 hours a night. We also find that kids who sleep less than 7 hours a night and in grade 10 are more likely, quite substantially more likely to report that they've used cannabis, been drunk in the last 30 days or year, and that they report that they are, quote, not happy, close quote. I've attended some webinars that were put on by sick kids, and I've spoken with some other folks in Ottawa who are experts in sleep, and there is very much a strong correlation between getting enough sleep and youth mental wellness. So this suggests that addressing poor sleep hygiene could have a big benefit for young people in our community. So we see sleep as a protective factor, having enough sleep as a protective factor, and I think we'll be addressing that with some of our actions moving ahead. I found this example to be really useful in discussing how the survey data can support development of strategies across Lanark County. It's something that's pretty tangible and close, and parents can do it. So I really hope you move forward on your upstream journey, and on behalf of Lanark County, I offer and look forward to collaborating with you as we learn and share together. Good luck.
So those are our partner experiences. We tried to include most of our sites in Canada. I know those will probably be most useful and most similar to you. But I also just want to talk about us at the Planet Youth team. We're a fun group of people. We are 19, I think, at the moment. We have a lot of different specialties. We have data analysts, we have evaluation experts, community development experts, advisors, communications officers, and more. So we're here to offer full, well-rounded support to each community that signs on to Planet Youth. And I don't know if Jan, you would like to say anything. We just opened our office in Guanajuato, so we do have a second office. We have one in Iceland and one in Guanajuato, which serves as the hub for Latin America. We have a lot of different departments such as advising, analytics, communications, partner relations, and more. So that's a little bit about who we are. And then I'll just end with that you can have a major impact in your community. And I hope that this was helpful and inspiring, and I hope this is something that feels feasible to you. So we'll answer any questions you have, but that's the end of our slides.
Thank you, Robin, for that presentation. It was great to see those videos. We felt it was really important to kind of give a picture of how this approach can look really different in every community, and it can be very tailored. So I'll mention again, we will share the slides and the recording, but at this time we'll move into the Q&A period. So if you have any questions for Jan and Robin, please ask away. We have about 25 minutes, and we have a volunteer that will be coming around with a microphone.
On? Test? Yep. It's on. Hi. Thank you so much for the presentation. I introduced myself to Jan, and I didn't get a chance to introduce myself to you, but welcome to our community. I'm a city councilor here at Timiskaming Shores, and thank you for coming. My question is around the structure. We talked about community coordinators, and a number of the videos talked about that. Can you talk a little bit about sort of the different forms that might take in some of the communities?
Yes, that's a great question. It's a little different, depends on how big your community is. Sometimes there's a community coordinator and then a coalition lead or a local community member lead. So for Lanark, for example, David would be that coordinating level, and then each community will have, each of the 9 municipalities in Lanark have a coalition lead. For a smaller community such as this, you may just have that one lead who also leads the coalition and is the main contact for Planet Youth. Usually this is a person on the team of the organization that signs on to Planet Youth. That's typically what we see the most. However, you may designate someone in the community to have paid protected time to work on this. I will say it's important whoever is the lead does have paid protected time. It doesn't have to be a new job. It can be through rewriting an existing job description. It may fall into someone's work really naturally, but they should have that paid protected time to do it and not be a volunteer or having to do another 40-hour-a-week job on top of their already existing one. Does that answer your question? Okay.
Hi, my name is Amanda, and I work at the Timiskaming Health Unit. How do you engage youth in all of this? So at what stage in the steps, other than participating in the survey, do youth get to be involved?
Engaging youth. Okay, we are always asking the young people about what they want, how they feel, and always trying to get that information into society, so they are really having the biggest impact, because what they tell us through the surveys is what we funnel out into society to the parents, schools, everybody around the kids. We also have separate questionnaires where we ask them to write about, why do you think it's important to delay the onset of drinking? How could you spend more time with your parents? Why do you think it's important participate in activities, extracurricular, etc. And this they write down, and this is a part of our toolbox. Basically, there are very many things in it that you can cherry pick from, but we ask and funnel out information in that way. So, for example, a couple of years ago, there was a young man in school who was answering this, and he said, well, I could spend a lot of more time with my parents, but they're always on Facebook, so it's really difficult for me. And we took that information and a lot of other and highlighted it into the parental community, kind of making people feel a little bit guilty. So this is the way we are engaging youth into the whole structure, getting information from them and funnel it out either through the research that you receive in the municipality and the schools, or through these special reports and initiatives, to let people know what they need to do in order for children to feel better. But we never let them take responsibility. We always ask the young people, but never make them responsible. But as I say, all our knowledge is coming from them, and everything that we do is because of their answers. I know it's a little bit backwards way of answering this question, but this is how we do it.
So would you invite them, or do communities ever have youth part of the coalition, or even, say, part of the decision-making process to proceed with Planet Youth?
That's a great question. So yes, the short answer is sometimes youth are, we don't always see them as part of the main coalition, but sometimes there are youth coalitions, and they feed information into the community coalitions. This is seen often in the United States, and I think some of our Canadian sites are also exploring this. A way to do this in which they're not responsible for changing the community. Sometimes we'll do a separate data presentation for the young people and get more feedback from them and talk about it, use guided discussions to hear more. Sometimes communities will provide funding, and they can choose initiatives that they would like to implement in the community alongside the community coalition. So there are ways to involve them. There are a lot of youth councils throughout North America, so that would probably be the most that youth are involved.
Good afternoon. Thank you for your presence here. A lot of the statistics that you showed were for grades 7 to 12. Do you find in doing your data collection within your communities that are involved in Planet Youth, is that where the programs end up being targeted, or are there even younger programs that come out?
Normally, we start by doing the questionnaires at the end of the compulsory school, and this is cross-sectional. It's not longitudinal but cross-sectional. There are some communities who have asked us to go lower in age or higher, and we have done that ourselves in our country, which is very, very useful. However, the effect of this, by addressing always the same age group, like the end of, the young people ending school, the obligatory school, they are really capable of answering things, also about the past, and by changing their environment, trying to, for example, like the substance use, try to reduce the onset, the time of alcohol. I can give you a figure. We were just discussing this at one of the roundtables at the break. Substance use follows cohorts. So of course it's important to if you want to know something at a younger age, that's fine. But at the millennium, in 2000, we also monitor the high schools. And we have a plus 80% response rate there, and we require that. 18% of all high school students had never become drunk. This is 16 plus. Last year, this was 53% of all high school students that had never become drunk in their life. So by constantly focusing on how to change the older age groups in the compulsory school and try to affect their environment and behavior through the means we've been talking about, follows them. Through these changes don't quit the day you start high school. And our Swedish colleagues, they have even gone further, up until 2025, and they see that young people who don't start drinking in compulsory school or high school, they don't suddenly start drinking when they're 22 or 20 or something. So that's, does it answer the question?
Yes, thank you.
Thank you.
Thank you for coming today. I would like to know, is it legal in Iceland for marijuana?
No. And if I can say, I mean, we are working with children, and there is absolutely no drug in the world legal for children. Nothing. Even though the industry is trying to target the younger age groups in every possible way, you don't have to be a rocket scientist to see the packaging and the marketing and all that. But we're trying to shy away from that. However, we have in our parliament today people who, in the name of freedom and liberty, think that everybody should have access to all the drugs in the world. And we're trying to avoid that. Fingers crossed.
Thank you so much. The Yes cards were one really concrete example of an activity that was implemented to increase protective factors. Can you give us a couple more?
So, I mean, there's so many in every domain. So, following the leisure time domain, beyond the leisure card, some of the smaller steps you can take before even getting to a leisure card, if that's something you choose to do, is just looking at the quality of activities that young people are experiencing in the out-of-school time. I know in my communities in the United States that often sports coaches are volunteers, or they have to be volunteers, and in Iceland that's not really the case. They're really educated in adolescent well-being and the sport that they're teaching. So one thing you can do is offer trainings to sports coaches, and that's something that's more of what we like to call like a quick win. You'll see results a lot faster than the leisure card, which may take more time to develop. In the school domain, we align policies with the school health and well-being policies, so aligning community policies with that so that adolescents have health and well-being policies across all their domains they interact with. Parent engagement is another big one, so making sure parents are communicating with each other. This might not even be a policy, but just really making that the norm in the community. This can be through, sometimes people do parent contracts in schools where they, all the parents come together on the first day of school and they sign this contract saying, I will protect my young person from bullying, and we'll make sure to communicate with other parents so that we know where the young people are in the afternoons, and they all agree to this, so the young people can't say, well, my friend is allowed to do this, and the parents know because they've signed that contract. So that's another great example. I don't know, Jan, if you have any others you'd like to throw in there.
This is the biggest question of today. But so we have gathered, like Robin was saying, we have gathered all sorts of initiatives in a place. We need to find a new name for that. We're discussing it. It's very masculine, and we call it the toolbox. So, but it is basically initiatives, campaigns, all sorts of things that people have been doing, both in Iceland and other countries, and you can kind of cherry pick from. I mean, we have had NGOs supporting us, like you mentioned, the Home and School with a parental contract. We have an NGO called the Together Group, which is constantly reminding parents about the importance of spending time with their kids. And at the end of the school year, they send a letter or something reminding parents about this. When the school starts again and winter comes, they remind parents about the outside hours and campaigns. We have one, Is Your Father Your Dealer, where parents think that it's better that they give alcohol to their kids than the kids get the alcohol somewhere else. We have a campaign called 18-year guarantee. It says when you buy a car, depending on the brand, you have a 3 to 7 year guarantee, but you have a child, then you provide 18 years of guarantee until that child is a grown-up. So all sorts of, this toolbox is full of ideas. Some of them might fit for you, others not. So, but yeah. This is probably the only question we cannot answer to the fullest. But thank you for asking that question at the end.
So I just have a question regarding, so you mentioned how in Iceland a lot of the coaches and the trainers aren't necessarily volunteer based. So I was wondering how they are hired. Like in bigger cities, it's through the municipalities that there are paid coaches, which mean better programs. So how is that model implemented?
If I might take the example of my city, the city of Reykjavik, the capital. Today, and don't be afraid, this was not like this 20, 25 years ago. Today, the city of Reykjavik spends 7% of its total budget annually into like activities, supporting activities, and there are more than 200 what do you call it, clubs or initiatives in Reykjavik who support all sorts of, they can support one activity or 5, and the city is paying for lots of this for the housing, for the heating, for the maintenance of buildings. But then the city of Reykjavik also has this leisure card, which is kind of not a card, it's an electronic thing, and they are supporting each and every child, coming to your question, with around 400 euros per year from the age of 6 to 18. And this works like you sit down with your child in front of the computer, and your son or your daughter says, I want to practice basketball this winter, and you find the nearest basketball club, you register your child, and your child goes to the first practice. And when your child is there, the money goes from the city hall directly to the club. So the club is getting money, and they can use this money, for example, to pay trained trainers with even university degrees in teaching and training. So, but these clubs, they have to fulfill certain criteria. You cannot just open a club and say, hey, I want to be part of the system. You have to show the city that you are capable of actually doing good things with and improving the conditions of this kid by having trained trainers, good facilities, structure, organization, everything good. Answer it? Thank you.
Hello, I'm Anna McPherson, part of the Kirkland Lake Multicultural Group. So our sort of mandate is to welcome newcomers to the area and to make them feel welcome. So my concern always goes to the needs of the parents first, because if their needs are met, then the children's general needs are met. How can we, and I also find that we've got a lot of apathy in regards to parents, well, they're just so burnt out. You know, as a parent of 4 kids, there's just more asks and asks and asks. In regards to getting out that sort of, getting people into the community to sort of share their experiences and share their passions with the newcomers, but we need the locals to be, connecting with the newcomers as well. Do you have anything to say about how you get the parents more engaged with the kids without parents feeling guilty all the time?
I can start, and then Jan, if you want to jump in. So parents are busy. That's the thing. That's the same across all communities. This is the one topic where it's like, how can we get parents involved because parents are so busy? Some of these initiatives that were mentioned in our partner videos and that you would find in our toolbox are all about just giving that time to parents to engage with each other, which I think they find very supportive and fulfilling and energizing, especially when you might be feeling isolated with raising your children or just going to work and then you're going home. And this really provides an opportunity for them to connect and decide as a group what's best for the young people in the community. So pulling parents together via parent cafes. Once in a while, parents do have the time to join the coalition, and I so recommend that. Something I talk about in the coalition building training, though, is because parents are so busy, it's important when you're asking something of parents to provide different activities for different levels of commitment, because some parents have a lower level of commitment, whereas some parents may be able to sit on the coalition, which is a much higher level of commitment. So that might look like sending out a newsletter through the school and asking them to share it with a few other parents. That's a lower level commitment. Or reviewing some materials and providing some feedback. That's like a medium level commitment. So we ask you to just think about all those different areas of commitment levels and make sure that there are always ways to be involved no matter the commitment level. I hope that answered your question a little bit.
Yeah, it does.
Okay.
It sort of helps, because I know some people, like you said, they've got the time to be able to put into it, but I know parents who work full time, they're like, I really want to be involved, but I don't have the time. So how can we sort of balance that out? Yeah.
It's a common theme across all sites.
Thank you. What we see in our current drug strategy in the district, which is come about because we're dealing with the problems that Iceland would prevent, we hope. And across the several pillars, one of which is prevention, we see 2 main topics or things that are totally across all horizontally, and that is education, which we're getting here. The other is stigma. And I notice that although you use the word transparency, stigma is not a word that you use in any of your presentation. And I'm wondering if you could just speak to stigma. I know it's a very general question, it's not detailed, but I say what I'm saying is on the back of this gentleman who asked, do you have legalized marijuana in Iceland? Because in this country, marijuana is legal, and in a little town like this of 7,000 people, there's 4 or 5 or more places to legally buy marijuana. So substance use is becoming destigmatized through society, which is a barrier in my mind to what you're trying to do here. So can you just speak to stigma? Does it arise, or how? I know it's a very general question, sorry.
Well, I'll start, and Jan, like I said, you can always jump in. So I think we don't really mention stigma because we're looking at just the causes of substance use. So we're looking way, way upstream and not even really making it an option adolescents want to choose. So we're looking at providing a lot of other activities, so that's the best option. That's the option that young people want to participate in, the sports or the peer group activities, versus really looking at the stigma and talking about how destigmatizing this is problematic. We're looking at, let's just talk about the environment that young people are experiencing and make it so that's not even an issue. They're not even going to want to choose to smoke cannabis because they have all these other options available to them in the community. I don't know if Jan, you want to jump in on that.
Another big question. The normalization is always, of course, something that increases consumption, making like marijuana sound almost healthy for everyone. But like Robin said, we're trying to address this from another perspective. Let me ask you a question. If you take the whole year and you were 15-year-old, from 1st of January until the end of the year, all the minutes and seconds, you take away the time you're sleeping, the 8 hours that you should be getting and you're not getting. You take away the part where you're actively in school, listening to the teacher, learning. You take away the very small time that you're normally communicating with your parents, discussing about things. And you take away the time where you have to go to the dentist or a psychologist or something. And the rest of the time, I'm asking you how much time that is. And you take all the weekends, all the time after school until you go to sleep, all the summer holidays, winter holidays, Easter holidays, Christmas holidays, all the special holidays. How much time do you think actually there is, how much time is this for a child? How much free time does a child have in percentage all over the year if you take every minute? You take away the sleep, school, discussion with the parents, and the dentist. Any wild guesses? This is, in a country like ours, Western country, close to 70%. And this time we call leisure time, free time. And this time we simply need to fill with something for the kids to do. Like the gentleman I talked to at the intermission, at the break. You have to keep them busy in structured, organized activities. And we're not talking about marijuana here. We're just talking about, have something else to do than, create the preventive factor there instead of having them hang out with their friends doing nothing and create a risk factor. That's when they go into the marijuana. I know it's another backwards answer, but do you get my point? Thank you.
So unfortunately, we have to wrap up the Q&A. Thank you for all those really thoughtful questions. I wish we had budgeted a little bit more time for it, but I think we'll be sticking around for a little bit of time after today. So if you have any more questions, feel free to come up and ask us, and you can always email me and connect that way. So at this time, I'd like to introduce Amanda Mongeon. Amanda works in substance use prevention and school health at the Timiskaming Health Unit and is the chair of the Timiskaming Drug and Alcohol Strategies Prevention Pillar. And she'll be giving some closing notes for us today.
Thanks, Erica. And please join me in thanking our speakers, Jan and Robin and Walter, who had to step out, and Bonnie for her opening remarks today. Thank you so much for everything. I'd also like to say that our acting medical officer of health, I work at the Timiskaming Health Unit, Dr. Glenn Corneal, sends his regrets today. He would have liked to have been here, but his schedule conflicted with the event. So he does send his regrets, and thanks all of you for being here. As do I. I would like to thank each of you for taking the time today to explore together how we might be able to use our resources to make a real impact on the health and well-being of people in our communities. Today I saw people connect after years, others meet in person for the first time, and for these one-on-one relationships and for coming and learning about something together, nothing compares to doing so like this together. So thank you all for seeing the value and for making the time to join us today. This model that we learned about really underscores for me the idea that we have what we need. We already have what we need to build communities that thrive. Each of you brings expertise, experience as caring adults, as dedicated public servants, as educators. Some of you are leaders. Some of you are great at planning. Others really know how to get things done. And we're already doing so many things that support this work. And we learned this morning that if we align ourselves, then we can have much more of an impact. And you put those together, and then you get to another data point that actually Walter didn't share this morning, and which is our high rate of social connectedness in this district, which is generally higher in smaller communities, and a real asset in work like what we're talking about today, which is, as Jon said earlier, structured, organized collaboration. Now, often when we focus on individual behaviors, especially negative ones like youth substance use, we get stuck in just talking about that behavior and how can we have less of it? And then our focus stays really narrow. But the Icelandic model gives us a chance to be motivated by that behavior, but then shift our focus to the conditions that shape it. And then by focusing on these conditions, we can have an impact on so many other things. The behavior becomes our starting point, our check-in, but the initiative really becomes about building community. And it's much more energizing to be moving towards something positive than away from something negative. Many of our existing initiatives in Timiskaming are converging on a similar idea. What we learned about this morning complements the work of the local drug and alcohol strategy. For those who are familiar with the community safety and well-being plans, it's consistent with that as well. The Timiskaming Children's Services Planning Table. Even the goals of every youth recreation group, municipal recreation program, our cultural groups, our faith groups, our schools, we're all aiming to help kids be more connected and more successful in school and in life. So the purpose of today's event was to bring us together to consider the feasibility of implementing the Icelandic prevention model here in Timiskaming. So what do we do next? First, we can have more conversations within our networks, with our municipal councilors, our school board trustees. Many councilors are in this room today. Also our young people whose perspectives on this work is essential. But to be more specific, if there's broad community interest and support, then local public health can help this initiative along. Substance use prevention, overall well-being are important parts of our mandate. But we can't own it, we can't do it alone, and we'll look to you to consider how to proceed. It can't be done without schools being involved because you are such an important partner in this work. We'll need a group of people to be an organizing committee to figure out the details about moving forward. Some organizations may be able to contribute funding or do fundraising. Others may be able to offer staff time or other in-kind contributions. And if we do move forward, we'll need more people to be on smaller, potentially local coalitions to make use of their local community data. We've had many great conversations today, and I hope this is the start of more. So let's start now. I think you've all been given a questionnaire, or it's around. Please take a few minutes to fill it out. Tell us what your reflections are on this approach. How do you think your organization might be able to contribute? Please leave it on the table or at the registration table on your way out. Nothing you write is binding. It gives you a chance just to share your initial thoughts. We invite you to stick around for a little while, talk to us, talk to the speakers, talk to each other as long as you would like. This is such a special opportunity. Before we end, I'd like to thank the team of staff led by our public health promoter, Erica Alterman, who worked so hard to make this event happen today. And again, I thank you for coming. Please get in touch with us anytime if you have questions, if you want to get involved in moving this forward, or you want to share your perspectives about ways to support health in our communities in any way. So merci tout le monde, miigwech, and thank you so much for everything today.